Terry Brooks with Kentucky Youth Advocates. Our vision is that Kentucky is the best place in America to be young. And for that vision to become a reality, we have to look at the health of children. And we know that in the Commonwealth, you cannot talk about the health of children without assessing and analyzing the implementation of managed care. One of the issues that KYA looks at in lots of areas, not just health, we look at it in terms of tax credit and educational opportunities, is the issue of access. Opportunities that are inaccessible are not opportunities at all, regardless of what's on the books. That continues to be an issue that you hear a lot of divergent opinions about in terms of the early stages of managed care. Are there accessible services? Are there equitably accessible services throughout Kentucky? Again, we really think that it's too early to make a declarative statement. We do believe that we're beginning to see threads that should be of concern, where that perhaps members have signed on with a certain network, and it turns out that providers have not located in that part of the state. So if I'm one of those members, regardless of what's on the book, if I don't have accessible services, then I don't have service at all. We are hearing a consistent theme that because of the hassles, because of the administrivia associated with providers and mental health services, is that they are spending enough energy and time on simple administrative tasks that the impact is that the number of children receiving mental health services or the depth of those mental health services are being reduced. When we talk about those emerging lessons, what do those really mean? Here are a couple examples. For instance, we know that one of the assets that in some states managed care has brought into a state is continuity of care. There are some troubling trends that would suggest that the antithesis may be occurring in the Commonwealth. As an example, we have those from-the-ground stories of children who already have gone through the hoops of discovering which medications work. Now during the transition, they've gone back to ground zero. And instead of being authorized to use the medication that is best for them, they've been put through hoop jumping again. That kind of process, instead of increasing the continuity of care, really disrupts the care. So again, what we hope happens is that concept of managed care helping with continuity of care, that the cabinet and other officials are looking hard and looking deeply to find where problems exist so that we can move managed care in Kentucky to a system where that young person doesn't have to go through hoop jumping again if we already know what works. If members get caught up into having to pay attention to providers, if they have to pay attention to jumping through hoops, to discovering where in the world they can reach their provider, what forms does that provider need? If the attention of the patient, of the member, is on the provider rather than on their own physical or mental health well-being, then we don't have good access. So what you want is a system that is seamless and simple and member-oriented. And when we achieve that, then we'll know that managed care has met the threshold of quality access.